Welcome. This is a production brought to you by the Idaho Commission on Aging.
Well, good afternoon, everybody. It is a fantastic day down in Southwest Idaho. We had that weird 7 inches of snow about the middle of the state 2 days before the beginning of summer. Go figure. It's just been one of those kinds of years. But we're glad that you are all here to join us for our June 20th Collaborative 2023 for the Falls Prevention Coalition of Idaho Steering Committee Collaborative. And we have some fun things that we get to talk about this time around. So fasten your seatbelt, as I say, and in the next hour, we will get started talking about all of these wonderful things that we can. Go ahead and take us to our next slide, please, Caitlin. As usual, you know that we do record all of these things so that those who can't join us can review it. And hopefully you're all getting familiar with the fact that we do have the website aging.idaho.gov/FPC-ID, as well as our YouTube channel. And the easiest way to remember anything about the ICOA and YouTube is the handle is Idaho, IDAHO, COA for Commission on Aging. So Idaho COA, and that's where you can find our recordings as well. Next slide, please. All right, well, what are all the wonderful things we have to talk about? There are many. We're going to do our little bit of an intro and welcome here like we're doing. We're going to change up maybe one of those things. We, of course, want to do a perfection of the agenda. We'll talk more about why that becomes important. Kind of our key topics for today are talking about our KPAs and the upcoming Falls Prevention Awareness Month 2023 that will take a bulk of our time. And hopefully you all have brought your good ideas for our collaborative discussion on your ideas for what we can do for that. Then, of course, we will do a review of our action items, both when we start and what our new ones are at the end. And then we'll close things down and get all y'all on your way before 3 p.m. this afternoon, Mountain Time, 2 p.m. Pacific Time. Next slide, please, Caitlin. All right, we are kind of, sort of, maybe changing things a little itty bitty bit things as we work through, and I need to do something. Hang on one second, please. Had a pop-up come in. When we work through, and I think this is where I am. Remind me, Caitlin, are we on our?
We're on the what we'll discuss today slide, Erin.
Oh, so I already did it backwards.
Yeah, you kind of already.
Okay, I did it backwards. Sorry. Flipping back real quick, we always want to make sure that we know how to be kind and polite to each other, which most of us do. One of which is to make sure that we speak slowly and clearly, which I obviously stopped doing the minute I got a little frazzled there. We also want to make sure that we speak slowly because we are often working with an ASL interpreter, and it just makes it easier not to talk over each other. So we'll try to kind of give you some guidance as we go along. Then we can now skip over the slide that we had on what we're going to do because I already talked about that. And that means we can pick up where we kind of were going to be leaving off. When we talk about the things that we do from month to month with these collaboratives, we try to keep them short, and hopefully that means that you guys can do the kind of the action items, as we call them, in your time, at your pace, when it's convenient for you, instead of trying to deal with all of them together as a group. So Caitlin, would you like to take us through our review of last month's action items, the stuff that we should have been working on up until today?
Absolutely. Thank you, Erin. Good afternoon, everybody. I don't know about you guys, but it kind of feels like fall. It's like 50 degrees where I'm at, up in Coeur d'Alene. It's a little cold. But I just wanted to review kind of what we've been doing over the past few months. We were able to develop our mission and vision statements, which were provided to you via email and through our brainstorming sessions. we were able to figure out the key performance areas and have all of you sign up for what you're interested in, which were also sent to you in an email. And then in addition to that, also the goals that went along with those key performance areas. So those are kind of what we've done so far. Very short list, but of course there's lots within that. And then as we keep going, just continue please to talk to people and your friends and your coworkers about the Fall Prevention Coalition of Idaho. Because as you know, many hands make light work, and continue to give us those recommendations for people you know that would be interested. And right now we'd like to kind of open the floor up to everybody. If anybody has any fun updates about activities, things you're doing, wins for the last month, things like that. So if you would like to speak about something that's exciting in falls prevention, please go ahead and raise your virtual hand and we'd love to hear it. And Sarah, do you mind repeating again, since that was kind of at the beginning, about your research and stuff, if you wouldn't mind?
You bet. Caitlin, thank you. Just sharing that Haley Merrick, who was initially part of the group, but I think has been restructuring her time, she and I and Tammy Sorrell, who used to be with the Idaho Commission on Aging, we are finishing a small quantitative study on looking at participants with the Fit and Fall Proof program and the impact of the program on their sense of isolation during the pandemic. So when Fit and Fall Proof classes had to be ended, being able to use that as kind of a measure of impact and now how they're feeling once they're back with the group. And it's been really fun to read the qualitative comments from participants in terms of just how important these community-based, remote communities programs are to hard to reach areas. So anyway, that's an update on fall prevention from the isolation piece.
Thank you, Sarah. Anybody else? Go ahead, Kelly.
I will be offering I found a venue to offer my third bingo size workshop. That'll be at the Hayden Community Library starting July 11th for 10 weeks. So I've got that coming up.
Awesome. And Kelly, was there something else that Kootenai Health as well for the bingo size, or was that what was included in that? The Kootenai Health Foundation.
Oh yeah, they had gotten a grant from oh gosh, ICA or ICO or Idaho Community Foundation, ICF, sorry. And they were able to get a grant so that we can to go towards bingo size, like supplies, like program incentives, prizes, and things like that. So
okay, thank you for clarifying that.
Sure.
That's great. And last time I looked, I think it costs about $1,000 to get started at a site with bingo size. But then there is that ongoing, because bingo size is like regular bingo. You like to have prizes and stuff. And so you have to be able to purchase those. So yeah, that extra funding, not only to get things started, but then to keep it running is really a good deal. And by the way, as we start getting these things underway and our members have different things going on, we will probably put that not only on the website, but also maybe make it as an attachment to what we send out a couple weeks before the meeting, just so everybody has a chance to share anything about events and activities and things, so that we make sure that we can spread the good word amongst our members.
Yeah, I would love to have some sort of calendar, that just had everything listed out for activities going on. Go ahead, Sarah.
This is a follow-up to Kelly. Kelly, I would love to connect one of the faculty members in the college here. She is very closely tied to the bingo, the oh gosh, exercise bingo piece. And I think there may be an amazing opportunity to help expand that statewide. So would love to connect with you and connect you with Linda Ransdell here at Boise State and other folks working in this arena. Super exciting to hear that's what you're launching there. Yeah.
Oh yeah, that'd be great. I can put my email in the chat box if you'd like.
Thank you.
If I just heard statewide and bingo size, that's why my heart rate just like tripled immediately. That's exactly what we want to see happen. That's fantastic. Yes, please do. And see, Caitlin, she loves me in spite of myself. But as I get rattled and lose my my screen reader at the beginning, I skip stuff because my brain starts going haywire. And one of the things that we do want you to do, you may have noticed we didn't have Caitlin go through and call on everybody to do an introduction, because we have things to talk about and we know that time is short and that we kind of sort of know each other now. We're going to go more to the, if you would all be so kind as to put your name, your organization, and your location into the chat, then we can capture that, but we don't have to take up 5 or 10 minutes to go through that. But that's also why we added these little updates, so that we don't want to skip over anything if anybody has anything important to share, as we have just had a couple of people do. So that's fantastic.
All right, before I move on, anybody else? Anything exciting? Wins? All right, we will move on. And Aaron, I'm going to hand it to you for the KPA discussion.
All right, I can do that. As I said, thank you all. That's not bad for a June. We're just getting warmed up, and literally we'll be getting warmed up a little more as well. we want to go to what we're calling the KPA Q&A. Not only does that have a wonderful ring to it, but we've been talking about our KPAs, or key performance areas. Hopefully you're all getting used to that terminology for a couple of months now. And each of us has been able to be grouped together with others who are interested in the same kinds of things, either as a priority or because that's part of your job, or whatever the case may be. And you should have received by now a KPA member list, along with a separate document that has KPA goals and objectives. And those are really where we are ready to kind of start the work of the coalition that will be more public facing. The mission and vision we have to have in place, and I think we're all likewise motivated, and the reasons we're here are very similar, but we do still have sometimes some different goals and objectives as well. But the KPAs will allow us to get to that work. We only had a few people step up and say that they were willing to facilitate, and we get it. None of us has, I was going to say, a lot of extra time. Some of us have no extra time, and even negative time, as we would say. But we did have a few people, though, who were willing to do that. Jim and James from Habitat for Humanity of the Treasure Valley, I think I'm allowed to say that, it used to be of the Boise Valley, are very interested in facilitating our trip hazard at home remediation kind of stuff, as well as out into the community. And Caitlin's going to be working with professional education and professional practice. And Bob Wood from Boise State has expressed an interest in helping facilitate the data and research, which is really good, because while I love it, it is not my forte. So I'd like to thank those people for stepping up and doing that. And we will be hearing from all of those people, or you should be hearing from those that will be leading your KPAs within the next week or so. And this is where, we got to try to get the work underway. So the person who is in charge, and I will send out this list as soon as I finish solidifying who it will be reaching out and just letting you decide. There's between roughly 3 and 5 people per group. So hopefully you'll be able to find some times that are pretty easy to work with. And within those groups, then you can take a look at the current goals and objectives that we've kind of started to outline and figure out, where do you want to prioritize the work? What do we want to work on first? So to speak, and then get some of that work done. That is why we have not put down a collaborative for us to get together. So we will not be meeting next month, which would be for July. But that doesn't mean we're not going to be working. It just means that we want a lot of that KPA work to be going on during that time, so that when we get back in August, boy, it's hard to think that far ahead. August, then we'll be able to say, hey, great, look, here's what we've done. We got our 10 KPAs. And here's kind of what those KPAs have decided that the work is going to be about, and what their work might look like. So with that, I wanted to see if anybody had any questions about the KPAs that we've put together so far, what the expectations are, how we're moving forward. If so, speak now. And you can just unmute yourself, that's fine. Caitlin and I may have done such an amazing job of putting all this together that you have absolutely no questions. That would be nice.
We'll go with that. We'll call that good.
We'll go with that. Okay. Well, of course, as always, if you do have questions, please feel free to reach out to Caitlin or myself, and we will be happy to help answer those questions. But if we don't, then we will move on to kind of the next bits of work. I think, like I said, most of us are familiar with the KPAs. If you are not, or if you have not been assigned to a KPA that you would like to work on, you can always let us know that as well. But we're going to go ahead and move on to our next slide, and perhaps the most exciting, at least I think it's the most exciting. I hope you do as well, because it's kind of the core of what we need to do as far as the Falls Coalition, where it came from and where we're headed. So every September, it is Falls Prevention Awareness, and I always have to be careful. Nationally, we recognize Falls Prevention Awareness Week, and we haven't done a week now for 3 years. ICOA started observing Falls Prevention Awareness back in 2020. Good timing, right? Right when COVID hit. But we started doing that, and we've done it as a month. And even then, it seems like it's trying to cram a whole lot into a little bit of space. But we are ready to move on to this already, because it's middle of June and it starts the 1st of September. And believe it or not, that is not a lot of time to get a lot of things scheduled. So we have been kind of building this up. And, at first, and I know that some of you have also done Falls activities and things around the state. So I don't want to make it sound like I was, the first and only one ever doing any of this kind of stuff. But as far as kind of a state event by the State Unit on Aging, which is primarily where we talk about a lot of falls is with older adults, it was ICOA that began in 2020 to do that. And because we have the pandemic, it's always been done virtually. And I'm kind of proud of what we were able to do. We did some social media stuff, of course, not a lot of in-person events because we weren't allowed to go out and do in-person stuff, but we did put together, and we've kind of built it up, started off with just a consumer seminar that was 90 minutes. We did 2 of those in the first year, and then we've added on to that, and we continued to add on one that we called Simple Steps, which is built on the Fit and Fall Proof program to let people know, hey, there's a bunch of stuff you can do at home without having to belong to a gym or have a bunch of fancy equipment, so that you can stay flexible and active and physically engaged, whatever that may mean for you. And we went through that with both, standard and seated some examples of some exercises that people could do. That was fun. One of the big ones, of course, was identifying trip hazards in your home and how to get rid of them. And of course, that one is kind of a natural that all of us go, yeah. Why do we have all of these throw rugs that people are tripping over, or cords that are across the floor? We went into things like poor lighting and, of course, slippery surfaces in bathrooms and grab bars, and really just a little bit of everything that anybody that's worked with home trip hazards, much less the ones that are out in the public, but these were ones that people could identify, and then hopefully that they could then remedy or find assistance with remedying. And that is, of course, where our KPA for a home trip hazard remediation is really going to play a key part. Then we added one in the last couple of years that was about kind of the importance that many of you have said, you know, we've got consumer education, we're working on that, but what about the health professionals? What about the physicians and the clinicians that either aren't doing assessments, they don't know how to do an assessment, they don't know why they should be doing an assessment, and if they do assessments and they find somebody that's increased fall risk, where do they refer them? Well, that, of course, is, again, the core of our work. But during this month, we did do a seminar, and specifically for, and we kind of combined the two, healthcare professionals and students. I like to call them, and our soon-to-be professionals, so that we ended up doing 4 different seminars. And that really has been really one of Idaho's strong points. We were highlighted in the report at the national level for doing those seminars. So it's been really exciting to get that started. And now what we want to do is to build on that. Now that we have a coalition, now that it's not just me and ICOA and those of you who are doing some individual things, but kind of make this a statewide event and really bring a lot of awareness. So of course, it's going to be the month of September, as it always has been. I love that, you know, timing is everything. The theme, the national theme this year is from awareness to action. And boy, if that doesn't really encapsulate what the FPC ID is doing, that's us. We're taking it from, we've all had these ideas, and now let's put it to work. So that's kind of good, I think. It's actually September 18th through the 22nd is the formal National Falls Prevention Awareness Week. We do the month. That is why we have to kind of do some rebranding, because National Council on Aging does provide us with a really powerful toolkit, but unfortunately, most of the materials are branded with the week instead of the month. So we kind of have to go in and recreate a lot of things. So if any of you have seen that, or you see that come across, that there is a national toolkit, please be patient for a couple of weeks. My hope is by the 1st of July to have the resources kind of culled out and customized for us and what the coalition is doing, and recognizing the whole month and all of those things. And we will be sending that out to everybody, as well as making it available on the website so that you guys can download that and use it to help promote Falls Prevention Awareness Month for your organization, and hopefully kind of give us, you know, the power of multiplicity, as they say. One of the things that will be there is a bunch of social media posts. And if through your organization, you can have your social media guru, just copy and paste it and make those posts to help us out, that would be good. We know that, you know, nobody has a whole lot of extra time, so we try to do as much of the front end work as we can and make it a matter of copying and pasting or printing or just sending out emails. So please look for that, and that's what we should be able to do. And I'm very excited to get that into the coalition and really make a huge effort this year. If you have any materials that you think would be helpful, and that can include articles, especially if they're articles with Idaho or local statistics, please do send those in. You can go ahead and send them to both Caitlin and I, and we'll make sure that we get those put into the toolkit as well, so we can help distribute those. I know it's always short notice, but remember, we're going to try to get that revised toolkit out the 1st of July. So if you could look at those maybe the rest of this week or the first part of next week, that would make it much easier. And we'll try to add those in, even if we get them later, if at all possible, but we can't make any promises on that one. So I did want to kind of, when you look at FPAM in the past, so to speak, I did want to recognize some of our members who have shared their expertise. In 2020, they acted as our expert panelists. Remember, we started that consumer panel all the way back then. Dr. Rodney Bates has been with us since the beginning, as they say. He's been working with us every year since on what some of the medical outcomes are from a person who falls. And Michelle Butterfield from our Southeast Idaho District Health, I never get the name quite right. She also was one of our first people to work with. Dr. Caitlin Kinahan from the VA joined us a couple of years ago, and she's been providing some of our pharmacy and our polypharmacy and risks of medications and falls risks, which, as we know, is a huge one. I think Kate is with us, Kate Dewey, who has been, like I said, part of the Simple Steps, where people get to follow along and actually do those exercises along with. So Kate Wilson. I don't know why I said Kate Dewey. Sorry, Kate Wilson. Sorry about that, Kate. But she's been up there. And then, of course, we do have our own Caitlin. I have way too many Caitlins in my head, by the way. Caitlin Gaines, who started with us last year and is joining us from the northern reaches of the state as well, dealing with physical therapy, physical activity, and why physical activity is so important to falls prevention. So in the past, like I said, we've done those seminars, but we've also done proclamations. We've also done press releases, social media posts, newspaper articles. And, you know, a lot of this, it's like kind of like the shotgun effect. You throw it out there and hope that something sticks, as they say, that something gets published, something gets posted. But that's why if we can have some more local people like yourselves, you know, putting it out to your local media, that is sometimes a little bit more effective than having it come from, you know, a state agency somewhere. We do want to do a lot of other types of things, but what I really wanted to do now is to give all y'all, that's my attempt at being Southern, a little bit of Southern, all y'all the opportunity to share what your ideas might be for ways that we can do pretty much anything that you guys want to think of. Please, I love out of the box stuff too. How can we help celebrate Falls Prevention Awareness Month? And remember, it can be consumer education, professional education, any kind of awareness. It can be health fairs and clinics. How can we let people know if they're at risk? How do we do trip hazard remediation? Think of our KPAs. Those are kind of some good areas to think of. So who has some fantastic ideas for ways that we can help celebrate, acknowledge, and kind of leverage Falls Prevention Awareness Month this year? And I know that a lot of you are creative, so silence is not an option. You can raise your hand or you can just unmute yourself to speak up.
Hi, this is Gail with Idaho Elk Steering and Balance Center.
Yes.
And we have participated in fall prevention week. In the past, we stopped doing it during COVID. We didn't do anything. But one of the things that we've done is offer free balance screens. And we've done it in various ways. We've done it at health fairs, and we've also just blocked time on our various clinicians and just had days set aside during the Fall Prevention Week for free balance screens. And we're lucky in that we have the advantage of having computerized balance screen equipment. So we're able to give the patient a printout, and then we can send a note to their physician if they wanted. But that's one of the ways that we've participated in the past.
And I'm not asking you to make a commitment necessarily here, but is that something you might be able to pick up again doing this year? Or is it something that we could figure out how to do outside of just your clinics?
I think it's something that we could definitely participate in. Well, it was during COVID was a problem, but we were also pretty short-staffed for several years, but our staffing is, we're almost fully staffed now. So I think we would be able to offer some balance screens.
Excellent, because that of course is where it all starts, is how do we figure out if a person is at risk of falling, so then we can make sure that we are preventative when we need to be. Excellent.
Yeah. So I think we could definitely commit to providing some balance screens.
Well, I love it when somebody says, I think we're pretty much able to commit. We'll take you up on that. Is there anybody else here that works in a clinical setting that, again, I'm not necessarily asking you to obligate to your organization at this point, but that might be something that you would be able to do? And I'm trying to think of all the different, we got Kootenai Hill, St. Luke's, St. Al's, the VA Medical Center.
I'm able to up at Kootenai. There's no reason that I can't reach out to our outpatient clinic and see if we can get something going in there. And Kelly, maybe we can collaborate too.
Ooh, I love that. She
Definitely.
just said the collaborate word. Yay.
No, I feel like it's weird that we haven't met yet, Caitlin.
I know I've seen you in passing and in random meetings, but yeah, not actually.
Okay. Right.
Yeah.
So, I was just gonna say that I've actually committed to the Kootenai Care Network up here, the provider membership up here. They asked about having one of their presentations at one of their service line meetings. And they specifically asked for fall prevention. So I've committed to that on September 7th. I don't really have anything, prepared, but so I'm very interested in the toolkit. And then there's on the 22nd, I was thinking about doing a fall prevention fair, reserve some space in the Health Resource Center, and we have the date. So that's something. I was just kind of brainstorming ideas on that as well.
So that's more than something. That sounded like actual dates. I mean, that was more than I had even ever wished to hope for.
Yes, they are actual dates.
Excellent. All right. Well, that sounds great. Does anybody know if they have any health fairs, just community health fairs going on in September at all in your areas? That's something that I would appreciate you guys keeping your ears open for. Over the past 3 or 4 years, I've been trying to keep up. And again, that was all during the pandemic too. So maybe just that there wasn't many, but I wasn't able to find a lot of them. So if you hear of any health fairs going on, please let us know, and we can hopefully leverage those even when it's outside of Falls Prevention Month.
I think last year the Senior Citizen Fair in Boise that was at the fairgrounds was in September. But I haven't heard this year, but I will see if I can find out.
That would be perfect. Please do. And if you could let us know, that would be great. Excellent. Well, that,
This is
like I said,
Kate,
is,
and
I'm sorry, go ahead.
this is Kate, and our volunteer center, kind of down the road from us, typically does a health fair. I believe in the past they've done it in June, but there was talk about moving it to September, I think. So if that's the case, I can kind of connect and plug in there.
Thank you.
This is Jeanette, and Idaho State University in the fall has historically had a geriatric symposium. And sometimes it's been a joint site, so sometimes it's run in Pocatello as well as the Meridian campus. It was, of course, COVID kind of derailed that for a while, but I do know that the geriatric symposium is in process. I think the date was in October, though, but it is definitely one that's joint with ISU and the students, the practitioners, the health professions at ISU, as well as our senior center. So I do know that there is a joint connection there.
Fantastic. Like I said, we'll take any month because we really want falls prevention to become a year-round, never out of sight or out of mind kind of event. So absolutely. And reaching those students, any of those of you who are here from universities, higher ed, all of that kind of stuff, anytime we can reach students and get them in the good habit of incorporating falls risk assessment and prevention, I think we're just one step ahead. Traumatic brain injury. Those of you who work specifically with TBI in any age group, are there, there probably aren't a lot of events around that, but are there any mechanisms that we can utilize to make people more aware of the impact that falls have on TBI, pretty much across the lifespan, and that's why they need to be aware of it?
I can't think anything off the top of my head right now, but I will certainly keep that in mind and try to find places and ways to do that.
Okay, great.
Yeah, let's start to brainstorm.
Yeah, we know that falls and TBI unfortunately go hand in hand. And while we often focus on falls being dangerous for older adults, I really think that it'll be helpful to remind people it doesn't just happen to people over age 60, that falls are dangerous for whoever may incur them.
I know that our Brain Injury Alliance, they have been handing out helmets at health fairs, like bicycle helmets. I can talk with them too to see if they have any ideas.
Okay, that would be great. Yes, please do. And always report back, let us know, and then we'll help disseminate it out to the coalition as a whole. Jim and James from Habitat, you and I talked just last week, and we know that you want to kind of have it be a dual benefit for both of our programs to work with Falls Prevention Awareness Month. Can you think of any mechanisms, any different things that we could be, should be, might be doing, talking about in addition to our seminar on trip hazards at home that could help people with finding and removing trip hazards at home?
Yeah, I think through our program, there are opportunities to have things remediated. So I know that we will come in and do assessments, and it's helpful if we've had a healthcare practitioner, who can do those audits, can say, oh yeah, you need to do this, you need to do that, and we're sort of like the muscle behind it. I mean, we can come in and make the necessary repairs. And something to keep in mind is that if someone is at 40% area median income or below, there is no cost to them to perform those repairs. I think that's important to remember.
Mhm.
And certainly we're open, especially for those folks who are above that, to have funding follow the repair. I think that's an important thing. But I think just making it known that this service is available. I would
Right.
say that our average client is over 70. We do everything from installing accessibility ramps to both inside and outside. I mean, we've done some jobs where they may have had steps within the home and we were able to ramp that up internally. So there's a lot that we can do. And a lot of it obviously is, you know, what's going on in that particular home or whatever, but just know that there's a viable resource available when it's needed. So I think it's more than anything, it's that, just knowing that we're out there and that we want to help. And we've received special internal training from Habitat International about working with this specific population. So we have definitely a sensitivity and more of a heightened awareness about what kinds of things need to be done.
Right, exactly. And that's really, you know, I think what many of us have experienced is we assist people in identifying they're at risk and there's something in their home that is a risk. But then what? If they can't afford to fix it on their own, where do they go? How do they even find somebody that's qualified to make certain repairs, much less the affordability of making those repairs? So yeah, I think that we'll get some promotional stuff put out with resources in addition to just the seminar that we've been able to provide in the past. So that'll be an important extension. Excellent. Krista, what do you think? Are you still with us? What kind of things can we do to help people know about your programs or things that they should know that can assist them?
Well, there's definitely multiple opportunities for spreading word about the Assistive Technology Project and our home modification resource list. The reason I had actually raised my hand was the thought about also doing a campaign about emergency response call buttons, lifeline sort of things. The what if you fall, can you get help sort of thing. So that was the idea I wanted to throw out.
Right. And, you know, of course, we all, the ultimate is to say, we want to prevent every fall from occurring. But hopefully we are all also realists and know that while that would be our vision, that it's not necessarily a realistic one and that there are going to be falls. So people who are at risk especially need to have some sort of mechanism, you know, and my mom would probably be mad if she knew I talked about her all the time, but she's 89. She lives on her own, independent. And it scares me that if she falls, there's nobody around that, you know, that she could, that would be able to find her and let her know or somebody know in time. So we've done some things to make sure that there are mechanisms that can help with that. But not everybody knows what those are. And again, there's the affordability of them. And, you know, that's kind of what we get caught into, is both the what are the resources, and then the second part is, and how can we make sure people can afford them? So I think that would be a good resource to add, and your resource list, Krista, that we can distribute to people who are in need of those resources.
And Sarah, go ahead. You've had your hand up for a little bit.
Erin, this is, you don't need to respond to this off of the off of the cuff, but I'd love to get your thoughts on, I know you looked real hard at the ACL funding request.
Mhm.
And I imagine that'll be coming out again. I'm wondering if in that funding request, there were some opportunities where we could set ourselves up for success in receiving funding based on building some capacity or some energy around something that we've done in a falls prevention month. So we'd love your thinking about how to capitalize, how to set ourselves up for success with that funding opportunity.
And I will have all kinds of things to talk about that actually probably not when September is over, but in the next couple of months. She's referring to an ACL grant that comes out every year. It gives up to $500,000 over a 4-year grant for falls prevention. And we were prepared to apply for it last year, and then we did not, but we will be applying for it this year. And yes, all of these things we want to include in that money so that we can help build up the capacity. You know, they're not intended to be ongoing funding, but build up sustainable efforts where we can fund getting people trained, for example, to do bingo size like we were talking about earlier, and get work with Habitat for Humanity and some of Krista's programs to make sure that people have access to the resources they need for in-home repairs and access technology or whatever the case may be. So really the whole gamut is open. And I will be talking more about that in general in a couple of months, as well as specifically with some of you, just because I know kind of some of the areas we need to hit on for the grant, but I do look forward to that. Unfortunately, it's due January of next year with funding May of 2024, which just seems like so far from now. But yes, we'll be pursuing that.
Yeah, Erin, thanks for providing that overview. I guess I was just thinking about our, planning, how do we prioritize what we do during a falls prevention month? And if there was something in that call for proposals last year that you were thinking, oh boy, if only we had, I don't know, an established relationship or evidence of some outreach specifically to members of the Hispanic community, or, just thinking creatively about how to prioritize what we would do.
Right.
Be helpful. Your knowledge would be helpful there.
Yes, and I'm sorry I misunderstood your question, but I like talking about grants anytime I get to talk about grants. But yes, speaking of that, is there anybody on the call today who has connections with some of our underserved communities? And by that, we mean, of course, our Hispanic communities, our Native tribes, LGBTQ+, and as always, our rural residents, they're always considered an underserved communities. Do any of you have any connections there or any ideas on how we can better serve some of those populations for Falls Prevention Awareness Month?
This is Kate. We in the past have worked with St. Mary's Clearwater Health System, who has a pretty strong team of community health workers that serve rural areas. So they're very integral as far as inviting us to health fairs that they do. And if we had activities and ideas that were in the works, I'm sure that they would love to be involved.
That's an excellent idea. We, in a prior grant, tried to work with community health workers and we're just not able to get engaged with them. So that's not only a great idea, but they're across the state. And we will definitely make sure that we work with St. Mary's and see if they can maybe help strengthen our connections with others around the state and get them involved, because they're the ones that are out there meeting with people, right? Meeting the people where they are. It's a great idea.
Krista, go ahead.
Project ECHO with the University of Idaho's medical continuing education is doing a whole variety of seminars for medical professionals, and seeing if we could get a session on fall prevention for them might be worth doing.
Yes, please.
Also, Idaho Extension has a couple of new projects. One that is doing poverty-informed training for medical providers, and another that is doing rural digital economy outreach, but digital literacy training, which that network going into all of the rural libraries might also have some opportunities to get word out.
More fantastic ideas. Unfortunately, our time just seems to fly by. If any of those of you who spoke up today, or any of you who did not but have ideas, please send whatever information you have, the names of programs, projects, if you have a contact name, a website, an email address, whatever you have, please send them along so that we can, put these together, because as they say, time is of the essence. It is already the middle to end of June, and we need to kick this off by September 1st. So a lot of planning has to go into that. And I would appreciate, Caitlin would appreciate, and the coalition as a whole would appreciate any insights and inputs you have to make those kinds of things happen. One more thing, because Krista just mentioned it, I've been also part of the technology group in Idaho, and what many of us forget, because we're all on this call, means that we pretty much have high-speed internet, but that 78% of Idahoans do not have access to reliable broadband, which means they can't do Zoom calls, they can't do telehealth, they can't, get online to find out some of these things. So we definitely, now that the pandemic is over, especially want to get back out into communities, do more face-to-face, things that don't necessarily require internet to be able to know about or to participate in. So we're trying to get that all wound up into the 2023 FPAM as well. Whew, you guys have already got me all worked up and excited about the things to come. I will be getting that toolkit customized, personalized, sent out to you about the 1st of July. And with that, Caitlin, are we ready to send it on back to you to finish us up for the day?
Yes, I will keep it brief. I want to be respectful of your guys' time. Thank you so much for being here. So just a couple of reminders on what we're doing now. Your KPA facilitators should be reaching out to you in the next week or so. So be on the lookout for that. And that after that, you guys should be able to set your first meetings, go over your goals, and then be prepared to start talking to this group in August, since as a reminder, we are not meeting in July. So back in August, we are excited to hear about all of the stuff that you guys have been busy doing. So just a review of our quick action items. Again, coordinate with your KPA facilitators, plans and goals and work plans within those groups. And then continue to talk to people about our coalition, and send us those referrals for individuals that want to be engaged. And then we will see you in August.
Keep up the good work, everybody. Keep up the enthusiasm. Remember, the more members we get, the easier all of this work gets to be, because we get to spread it around to multiple people. So you know where to find Caitlin and I, and we look forward to hearing from you all soon and getting caught up on the wonderful things everybody's getting done with their KPAs.
Thank you, everyone.
And tomorrow is the first day of summer. Yay. Enjoy, everybody. Thank you.
Have a good day. Thank you.
Thank you.
Thank you for joining us. This has been a production brought to you by the Idaho Commission on Aging, supporting the well-being of aging Idahoans since 1968. For more information on resources to stay at home, stay healthy, stay safe, and stay informed, visit our website at www.aging.idaho.gov.